Imagine a medical mystery. One that starts really small, no symptoms at all, and then just quietly grows for 7 years until it's something huge, something life-changing.
Yeah,
That's what we're diving into today. A case that really shows what could happen when things get delayed.
exactly. We're focusing on a condition called Buschke-Löwenstein tumor, BLT for short.
Definitely not the sandwich.
Hey, no, not the sandwich. It's rare, often misunderstood. And our insights today, they're coming from a really interesting article.
Okay.
It was published August 11th, 2025, in Genesis Scientific Publication by Bukamza F. and colleagues.
And importantly, this work got a sharp review from Dr. Reza Lankarani. He's a general surgeon, the founder of the Surgical Pioneering newsletter and podcast series, and also on the editorial board for the Genesis Journal of Surgery and Medicine.
That's right, a very credible source.
So our mission here is to unpack this specific case, understand that patient's journey, and really explore why time is just so critical with conditions that, well, might seem harmless at first glance, but can turn surprisingly aggressive.
Absolutely. Let's get into the case. It's about a 56-year-old man.
Okay.
He comes in with this giant exophytic perianal mass, basically a very large lump growing outwards near the anus.
And you said giant, but the key thing is this wasn't sudden, right?
Not at all. That's the crucial part. It had been slowly getting bigger for 7 years.
7 years, wow. And initially?
Initially small, no discomfort. You can see how someone might, put off checking it out.
Sure, easy to ignore if it's not bothering you.
But over time, things changed. He started having real discomfort when sitting, when going to the bathroom,
Okay.
intermittent bleeding, and this persistent, foul-smelling discharge. Not pleasant at all.
Definitely sounds like it progressed significantly.
So when he finally sought help, what did the examination actually show?
Well, the clinical picture was, frankly, alarming. The exam revealed this massive papillomatous tumor.
Papillomatous, meaning sort of cauliflower-like.
Exactly. Finger-like projections, a cauliflower surface.
And the size.
About 15 by 20 centimeters.
Oh.
Wait, 15 by 20 centimeters?
Yeah.
That's huge. Like a small dinner plate almost.
Pretty much, yeah. Small dinner plate size. It had these lobulated, sort of rounded edges and ulcerated zones, areas where the surface was broken down.
And where exactly was it located?
It was extensive. It stretched from the anal margin right into the intergluteal cleft, that's the crease between the buttocks, and even up towards the base of the scrotum.
Okay, so after all that time and seeing this huge mass, what did the tests say it actually was?
The histopathology, looking at the tissue under the microscope, confirmed it. Buschke-Löwenstein tumor.
BLT.
BLT. And what's fascinating here is that BLT is technically a rare variant of giant condyloma acuminatum.
Which is related to HPV, right? Genital warts?
Precisely. Usually linked to the low-risk HPV types, 6 and 11.
Okay, this is where it gets kind of confusing, or paradoxical maybe. You say low-risk HPV, and the histology, the microscopic view, looks benign.
That's the paradox, exactly.
But its behavior sounds anything but benign. 7 years of growth, massive size, ulceration.
You've hit the nail on the head. Despite looking benign under the microscope, BLT acts aggressively. It infiltrates nearby tissues. It's locally destructive.
So it's not cancerous in appearance, but it acts like it locally at least.
Well, it acts aggressively locally, and here's the really crucial point. It carries a substantial risk of actually transforming into squamous cell carcinoma.
Becoming truly cancerous. How high is that risk?
Shockingly high. Reports range from 30% up to 56% of cases.
30 to 56%. That's astounding for something that starts looking benign.
It really is. It underlines why you can't judge this book by its cover, so to speak. It's not just a slow-growing lump. It's a potential time bomb.
This case just perfectly illustrates the danger of delay, doesn't it? Diagnostic delay, treatment delay.
Absolutely. Left untreated, BLT can obviously reach these giant sizes we discussed.
Leading to what kind of problems?
Significant local morbidity, meaning illness and dysfunction related to the tumor itself. Think pain, bleeding, infection. Also, considerable social embarrassment, naturally.
I can only imagine.
And serious complications, too, like fistulas, abnormal connections forming, or even obstruction, blocking bowel movements. It just spirals.
So how do doctors even approach treating something like this, especially when it's gotten so enormous?
The standard is surgery, complete surgical excision, cutting it all out. And importantly, with wide margins.
Meaning taking extra tissue around it to be safe.
Exactly, trying to ensure you get every last bit of affected tissue. But it's challenging.
Because of the size and location.
Yes, and because of its aggressive nature, recurrence is common. Even with wide margins, it's hard to guarantee you've got it all, especially when it's infiltrated deeply. It often comes back.
Man, this single case, this deep dive into it, it's such a stark reminder, isn't it, that things looking benign initially can just escalate dramatically if they aren't dealt with promptly.
It really is.
Makes you wonder how many other conditions out there might seem slow-growing or initially benign, but are hiding this potential for aggressive change if left alone.
That's a really provocative thought. It certainly underscores the importance of early assessment and intervention, even for things that don't seem urgent at first.
Absolutely. Vigilance is key,
Indeed. And if this discussion about Buschke-Löwenstein tumor has caught your interest and you want to understand more about the critical need for early action,
which you probably do after hearing this story.
right. Remember, this deep dive was based on that article by Buchenza et al., and it benefited greatly from the sharp review by Dr. Reza Lankarani, who, as we mentioned, is an editorial board member at the Genesis Journal of Surgery and Medicine.
If you want to access more details, maybe continue your own exploration, you should check out the Surgical Pioneering Podcast Series application. That's available at https://codedx.me.
And you can also find more excellent resources and articles directly at the Genesis Scientific Journal website, which is https://www.genesispub.org. Definitely worth checking out.